Welcome to Talks at Jarvis. My name is Melissa Marquez, and during these talks, I sit down with some of the brightest minds in the dental industry. Today, our topic is how to prepare your teams for patient calls in 2021, and we'll be discussing specific ideas on how to improve your call conversion results in the coming year. Our special guest today is Katie Tinkle. Katie is a strategic consultant with Callbox, an organization that provides call tracking, recording, and feedback for dental practices and groups, as well as many other industries. Katie has worked with Callbox clients for the last 4 years, helping to develop office teams and corporate support team members on how they can own the phones and take control of their outcomes. Welcome, Katie. Thanks for being here today.
Thank you. Thanks for having me.
So I really love this topic. I think, no matter how many locations you serve, and I think it's really interesting that you guys work with other industries outside of dentistry. But in dentistry, no matter how many practices you have, that initial phone call from the patient is so important. It really determines the number of patients that are walking through your door every day. So I think anyone can benefit from learning a little bit from your lessons that you're going to share with us today. And you focus a lot on this in all across different industries. I really would love to hear about you first, more about you, and kind of dig into your background a little bit. So you actually are super passionate about learning and development. How long have you been coaching people?
Yeah, so I've been in staff training and development for the last 10 years, really since I graduated from college. I knew that's what I wanted to get into. So worked in the human resources field and did some internal staff development, and then eventually joined Callbox and have been training more on the client side since then.
That's awesome. Would you say, and I'm kind of going to throw you a curveball here, is there anything that you think is sort of unique to working with dental practices? I know you work with other industries as well, but is there anything that kind of sticks out to you about dental practices when it comes to coaching them in regards to calls that sticks out for you a little bit?
Yeah, there really are some key differences with the dental industry, and maybe this could stretch to healthcare as a whole. In a lot of other industries that I've worked with in the past, they're very driven by making the sale, and even the front office staff is typically incentivized by the revenue that they're bringing in. When you branch over into healthcare, the motivation is a little bit different. So working within dental has really changed my perspective in a lot of ways on that first initial contact with the patient, because it can't just be about the sale. It's about taking care of people and making sure that they get the care that they're looking for, hopefully from your practice. Hopefully that will be the best fit for them. But it is a different approach. It's less about the money when it comes to training a front office staff member. And it's really more about patient care and making sure you're communicating the value of that patient because of who they are, not because of what they're necessarily going to bring to your practice in terms of money. That adjustment has been really key in my work with Callbox to bridge that gap a little bit into the healthcare industry.
Gosh, that's such a good way to look at it. And I know from my prior life and experience that I believe that front office team members would respond really well to that approach, because I think most people got into the dental industry or started working at a dental practice because they did want to help and they had some sort of interest in being in an industry that really does help other people and is healthcare aligned for sure. So I'm sure that they respond very well to that. What other types of industries do you guys support? I know we're going to focus on dental today, and I've mentioned a few times that you work with other verticals. I think it'd be interesting for those listening today to kind of hear everything that Callbox does. Would you share with me what other verticals you support?
Oh, absolutely. Yeah. So Callbox actually started in the automotive industry, which, when you think about car dealerships and a car salesman, it's like the furthest thing from healthcare. But that's where we began. We have branched into different types of healthcare, veterinary practices, home services, if you think about like calling a plumber to come to your house, maybe for some work, and even in, multi-family housing, that kind of industry, anything that requires a phone call to schedule an appointment, and that's kind of where the business starts. Callbox could apply to that kind of industry. So those are our main ones. We also do some work in insurance. I'm trying to think if I've hit all of I think those are the main, the main industries outside of dental. But if you think about any industry where it requires that phone call for the purpose of booking an appointment, Callbox can help any company that applies to.
Fantastic. And, Jarvis is in the business of metrics and measuring things and recording data. Is it pretty common when you first start working with a practice or a group for this to be the first time that they've ever really started measuring their outcomes when it comes to phone calls? Or are most, would you say, coming to you with some sense of what's happening with their phone calls?
That's a great question. For the most part, offices come in thinking they have an idea of what's going on the phone, but not having real numbers to back it up. So they have a feeling or a sense of maybe answering the phone throughout the day. And so they come in with some preconceived ideas about it, but very rarely do they come in with hard numbers that say, we know what our practice is already handling. And a lot of times we spend the first, 90 days with Callbox of just gathering that data and explaining it to the office, because oftentimes those ideas that they came in with can't be supported by the numbers. And so having those, actual metrics where, as the consultant, I'm just the third party delivering those metrics. It's the numbers that really tell the story. And so that's typically where we start.
Would you touch on for me quickly, just specifically, what do you measure when it comes to the phone call? And I know we'll talk through what you look for in terms of, your call review process and what feedback you give them. But from a pure data perspective, what do you guys pick up to measure in terms of your dental clients?
Yeah, great question. In its simplest form, we are looking at a specific acronym that Callbox developed. The acronym is CRISP, CRISP, and each of those letters stands for a different piece of our reporting platform. So it's easy to remember. We're listening for callers who connected to somebody who can help them. That's the C. Then we listen for those appointment opportunities where we invited them into the practice. So RI is request and invite. Once we've invited them into the practice, we're listening for the S, which is schedule. Did they convert to a booked appointment? But because we know not all callers are going to convert on that first call, a P stands for pursue. So that's going to be where we're flagging calls for opportunities that didn't convert to a booked appointment, but potentially would need a callback or some kind of follow-up conversation to get them actually on the schedule. So CRISP, it's all based on the appointment opportunities and making sure we are providing the insight on the phone call kind of process to get to that booked appointment. So all of our metrics surround that.
I love that. Acronyms make things so much easier to remember and to connect with for people to relate to, because one of the things we experience at Jarvis is the first time people start measuring things, there's sort of that resistance to embracing what the numbers are telling you in the beginning, because you have certain beliefs about, like you said, what you think is happening, and then you see the numbers and it can be very eye-opening. So I think an acronym would help embed, what is it to stay, what's important to stay really focused on.
Oh, for sure. And it gives you something too to consistently go back to. So if we're always looking at that connect metric, that's an easy one for offices to both relate to and then to go back and check later. So they're not just looking at, this black hole of information. It really narrows it down to these are the 5 most important things that you're going to focus on. And they can keep going back to those over and over and over again as, staff turnover causes the need for new training, or even as the office environment changes, which of course we're going to talk about, I know, but we see that happening over the course of time.
Yeah. That's a really great segue into one of the biggest topics of our call today, which is how's the data indicating that call trends and things like that changed over time, especially over the last year with COVID and the year of 2020 and some of the behaviors and never foreseen circumstances that we had in 2020. I'm certain that those somehow impacted the nature of the calls coming in. How did it, when we went through 2020, can you touch a little bit on some of the trends that you saw, some of the changes maybe that 2020 had in terms of an impact on calls to the practice, the nature of the calls, or any of those data points?
Yeah, absolutely. I mean, if you could point to anything that COVID didn't impact, that would be a miracle, I think. It was the impact is so wide and large across every industry I know. Specifically as it pertains to phone calls, one of the biggest trends we saw in 2020 was an increase in overall call volume. And this was true really across every industry that Callbox works with, but especially in the dental industry. We have seen that there is just a need for more phone calls before a caller, can actually get into the practice. So what that might look like is the first phone call is just a, hey, are you guys back open for your normal business hours? That's all they want to know because they can't figure out their own schedule. There's all these additional factors they have to consider before coming to a practice. And so the initial phone call was really basic. And then they required a second phone call to talk about, actually getting on the calendar to book an appointment. And then typically there's additional information needed about the health and safety procedures from an office. So that may be an extended phone call, or it may be an additional phone call to pre-screen the patient before they even can show up at their dental practice. So where it used to take maybe one phone call, possibly a reminder phone call for, one patient to show up at the practice, now all of a sudden we're looking at 4 to 5 phone calls that are much longer in length before somebody can even show up. So just the sheer volume of phone calls, other than really the month of April when everything was really shut down, volume was just off the charts from what we had seen in previous years, both in, like I said, number of calls and in call duration as well. That trend has had a huge impact on our practices.
Mm-hmm. That makes so much sense. And it's probably something that not a lot of people saw coming.
Mm-hmm.
So there probably was not a lot of sitting down with our front office team and talking through, how are we going to respond to these questions?
Right.
Communication is so important in the office that if patients are going to ask questions of that nature, especially around safety and what protocols the practice is following, training of those team members is so huge because you have to anticipate what types of questions are being asked, which to me, what an advantage you have in being able to record those and report that feedback back to the practice so that they're really thinking about how do we answer these questions and how do we reassure patients that it's a safe place to visit.
Oh, definitely. Well, and not to mention, with COVID, we were, sort of leaning toward less staff in the office too. As offices were reopening, it was okay, what's the bare minimum of people that we can have together for the safety of their employees? And so the training was huge because not only were we working with more phone calls, we were working with less staff members, which is not the ideal combination there. And if a team member was exposed, had to be out for a few days, then you're training somebody brand new to answer those same questions. So making sure there's consistency across was really important. And phone call recordings are a great way to make sure you're training on the things that really matter and on the questions that callers are actually going to be asking based on true caller behavior, not just what we are assuming they might ask.
Right. Well, because of that, because that you're gonna, you're experiencing an uptick of a particular type of question or concern from patients. Did you recommend or do you recommend any sort of scripting around that? Like, is it a best practice maybe for them to actually have something as a guideline to use? And I know every patient is different. So scripting and verbiage is always a little challenging in dentistry because you have to still use your judgment and you have to still, stay connected to that particular patient and what their needs are. But do you recommend formulating some sort of scripting for your practice teams that are handling phone calls, especially in situations like you're describing on the heels of COVID?
Right. Oh, we absolutely do. So Callbox's consultants actually work alongside offices to help them build scripts that will work for their teams. Always when I'm training on something like that, there is the recognition and understanding that every office personality is a little different. And what makes a great front office agent is the ability to anticipate a caller's emotions that are attached to the questions they're asking and really provide that sympathetic response to what their questions are. So I'm never going to tell an office just read this to your caller because that doesn't get a great patient experience or caller feedback. But we do encourage them to have a framework that they're comfortable with that can be adjusted maybe slightly from person to person so it feels a little bit more natural. And the way that we develop those is by working with an office, getting to know them, and also using the examples and experience that we gather from other practices. What we've seen might be working somewhere else, we can help apply to new clients when the questions arise. So it's very much a partnership. Callbox is very big about getting into the weeds with our clients. And so we want to know, like, what are the things that are really plaguing you day to day and how can we help you combat those? Throughout this year, developing new scripts was one of the biggest activities that we did, to the point where we've actually even published some recommendations to our clients even before they were asking about it, because we knew these questions were coming. And so to kind of try to get ahead of what we could.
Love that. One of the major takeaways I would love for people to get from our time together today are the top 3 reasons that patients do not schedule an appointment. And I'm so curious if you've seen any change in those just based on what we're talking about here today and some of the trends we're seeing in terms of the questions that patients are asking and the concerns they have about coming back to the dental practice. Overall, even if COVID wasn't an issue, what are those top 3 reasons that people will not schedule when they call the practice?
Yeah, great question. The top 3 are going to be in kind of different orders depending on the year, but calendar or the schedule availability, and insurance. So if an office doesn't take a certain insurance, and then price is going to be up there as well. Those are the main topics of conversation that we find offices are discussing on the phone that lead a caller down a path either to convert or not to that booked appointment. Those are the most consistent questions asked. And at Callbox, we actually use a combination of artificial intelligence and human reviewers to gather that data together. So we're using AI to identify some of those specific keywords that are said on the call. And then we're using our human reviewers to go in and narrow down what was the actual reason that the caller didn't book an appointment, even if these other topics were actually discussed on the phone as well. Kind of what was the sentiment of the caller, if you will, toward those responses.
Okay, great. So to repeat that back, schedule, insurance, and fee, basically, price,
Yes,
right?
that's exactly right.
Okay, got it. And you mentioned you've seen a little bit of a shift just depending on the year and what was the number 1 item. Did you see any changes as we went through kind of the recovery of the pandemic and opening practices back up? Would you say that's changed last year compared to the year before?
Yeah, so we did a study this year of looking at 2019 versus 2020. And what we saw was an increase in the number of callers not booking because of calendar. Just the availability of the office had changed drastically. So whether that was, oh, this office used to be open, 5 days a week, now they're only doing 3 days and that doesn't work with my schedule. That could be a reason. And that would fall under that calendar. Or one of the biggest plagues in 2020 was coming back from having been closed for a month. We were trying to rebook all of those patients that had to be, canceled during the shutdown. So once we were back in office and trying to get them rescheduled, there wasn't enough room in the schedule to both get them rescheduled and still balance all of the new calls that were coming in. Lots of people were wanting to get out of their houses and kind of catch up on some of the things they hadn't done while they were working from home. Dentists happened to be one of the people on the list to call. And so they would call, try to get an appointment booked, but offices weren't booking for, 6 or 8 weeks, trying to manage, all of the calls coming in. So the calendar went from, it was in our top 3 already from years past, but it definitely was the number one reason across 2020. At 37.8% of appointments not booked were due to calendar. So you're looking at, almost 40% there of those appointments not booking. So a huge impact.
Yeah, big time. The good news is that outside of just not being open on a particular day, I do think that is a barrier that with the right verbiage and training, you can get over and across that barrier with patients most of the time, if you're willing to be a little flexible and encourage some different behaviors on the patient's part as well. When you're listening to these calls, and I know they go through human review, which I love, I've used services in the past that are just, completely based off certain words being used in the call. And so the human review can really pick up on some of those nuances that lead to actually seeing a change in the performance of the practice.
Absolutely.
What kinds of things do you provide feedback on when you're going through your review process of the call? Are there particular mistakes that you hear practices making that you feel like you have to coach on time and time again?
Yes, definitely. It's funny. It's, most of our offices, it's repeat, what they're dealing with, whether they're in, California or Texas or wherever across the US, the conversations sound quite similar. One of the biggest coaching opportunities that we see is coaching an office to take themselves out of what we call order taker mode. So that's where they're just answering the caller's question and moving on, and really get them to remember that this caller that's calling in is an actual person, a potential patient opportunity. And so rather than just answering their questions and getting off the phone as fast as they can, kind of leaning into what that conversation could evolve into. So that could sound something like, possibly providing a range of prices on a phone if somebody's asking about that. But then following that question up with, what is it that you're really looking to book? And is there, something that maybe we could get help from insurance from? Do we offer payment plans? It's going that sort of extra mile with the patient, because the patient isn't always going to know all the questions that they should be asking you. And so giving them some guidance on how to, interact with their dentist really is helpful. And the same thing can apply when we're talking about the calendar. As exactly to your point, if callers are calling in and we're now not open on the day that they prefer, just saying sorry and hanging up the phone isn't a great response there. So really leaning into that and saying, okay, why is it that you just need that day? Could you squeeze us in on another day here? And really helping the patient kind of get to that next step of booking the appointment really separates the high performing dental offices from the, lower performing, I would say, offices. Some of that scripting is coachable for sure. Offices, that really lean into that and are committed to adjusting how they talk to patients are the ones that see the change in outcome to their phone call performance.
So it's almost like that, yes, we can change up our verbiage and make sure we're saying the right things, but I think mindset's so important from how we approach that call and treat the other person on the other end as a real live person. And I heard you say, don't fall into kind of just checking the box and, getting everything that's on your list.
Mm-hmm.
Yes, you have to get that patient's insurance. Yes, there's things that you need to gather information wise, but that patient also said they'd been in pain all night. So how do we acknowledge that? So not falling into list taker mode. And then being persistent, I think, is the second thing that really stuck with me that you said. Don't just accept, if they're asking for fees and you've given that to them, don't just assume that means they're not going to come in because they're a cash patient, but then assuming that the next logical thing is for them to schedule now.
Mm-hmm. That's exactly right. And I think all of that comes back to the patient-centric nature of the conversation. So as soon as we make that about, as a front office staff, make that about myself and my schedule, then we're going to lose on and what that patient experiences from us. I was actually on the phone with a dentist last week who has been pretty shocked by his call box data. And one of the things that he just couldn't believe is that his front office staff was approaching these patients as they fit conveniently into their schedule, rather than going above and beyond to make sure that they got them on the calendar somewhere. Specifically in the emergency situations like what you're mentioning, he had no idea that that was even happening. And how would you? Because that patient is just going to call another practice and get in where they can, especially in an emergency situation. So it was by reviewing his call box calls that he was able to hear, oh my goodness, that patient had a need that we could have met. It was a little more inconvenient for us, but we could have done it. Instead, we sent them down the street to another practice. And I mean, no dentist office can afford to do that right now. There is such a need to keep as many patients as we can. So having that kind of awareness and being able to both train and coach on those areas of opportunity can be a game changer.
I totally agree. I think having worked with groups of practices in the past, I think dentists and people, even in DSOs that, in my prior life as a regional manager, for example, the first time, and I was in that type of role, the first time we rolled out any sort of call tracking and call recording, it can be shocking because your team members, they're nice people, when you see them interact with patients going above and beyond, that sometimes they're just not aware of how the things they say on the phone sound to the other person, to the one receiving it. And so it is a little bit of a shock factor initially. I used the example earlier of a patient that maybe says they're in pain all night long and then it's not acknowledged. That exact scenario happened with one of my team members. And we happened to be listening as a group, just as kind of a training exercise. And that team member was, they knew that they had done that, but to hear it played back to them was a whole other story. Like, I didn't even acknowledge that patient was in so much pain. So it can be very eye-opening. So I love that process that you follow and walking the team through it, because I think there's a lot of value in coaching around those things and listening to them to really understand the other perspective.
For sure. And that ability to self-coach and self-correct strengthens the office staff so much. So, with the call box data, one of the great things is we're filtering out the calls that you don't need to coach on. If the appointment's already booked, then that one was probably fine. Better to focus on where the low-hanging fruit is, if you will, and coach on the ones that were, opportunities that didn't book. And I've been in, pre-COVID, we used to do a lot of these trainings in person. And so I've been sitting around the table with front office staff and played call recordings and had them, you tell me, like, what do you think should have been done differently? And how could this caller have been helped? And it is kind of getting them away from the front desk for a minute to listen to a call recording that is so eye-opening. That they'll coach themselves if they have access to the recording, I can help facilitate that in a lot of ways. But honestly, it's hearing their own voices and their tones on the phone that give them the the most, I would say, motivation to make changes, because it's a lack of awareness. They just don't know what they sound like.
Yeah, absolutely. Okay, well, kind of moving on, I think we've got some really great ways that we can identify, those top reasons that patients aren't scheduling, how that's changed in the last year, some of the biggest mistakes we may be making on the phone. What do you think the one to two, maybe three things that either practice owners or DSO regionals or leaders can do or can coach their front office team members on as it relates to incoming calls? I know we've talked about a couple of different things to really focus in on. What would you say are the top one to three things that someone who's in a leadership role should think about or coach their front office teams on for success in 2021?
Yeah, good question. So the first one is a repeat of what we've talked about, but the number one thing is just making sure your office is not entering into that order taker mode, that they are keying into the true need of the patient on the phone, and that you're training with that in mind. So it's not just about the script or just about making sure they know when your office is available, but really leaning into the conversation. And with the recognition that they're, typically we're not hiring somebody with a strong sales background in our front offices.
Yeah.
So coming in with that, hey, this is for the best patient experience we can provide. That motivation is going to drive a lot further than we need the revenue. So that would be the number one thing. A second one would be to pay attention to your call volume throughout the days and weeks. So one important piece that I think gets missed a lot is we can staff according to when the phone is actually going to be ringing. So just because you have an influx in calls doesn't mean we have to hire a whole nother full-time person. And we might not be able to afford that at the practice today, but having a plan for when somebody can't get to the call, if that looks like, maybe hiring a part-time person who's going to come in during your peak hours during the week. That could be, most offices see that at the 9 to 11 range on Monday mornings. That is a peak call volume time. So we want to have an extra person available to answer the phones. Maybe that's hiring somebody, maybe that's pulling somebody from, the back office who's used to checking insurance to just run up during those 2 hours a week to help us with those overflow calls. I've seen offices get really creative with this and actually send calls, that don't get picked up at the office to a whole different location. So we can get fancy if you want to, but you can also keep it simple and just, have another team member at the office that can jump on the phones. But the key to that is where it matters most for your practice. So understanding your volume peaks throughout the day and week drives when those people are going to need to be available. So that's, I would definitely say, a strong second, because the call volume hasn't ceased. We are continuing to see the numbers kind of at the peak of what they were in 2020. So even in my January analysis, the phone volume is not going down. So we need to be able to still maintain, answering those particular calls. And then one more that's definitely going to be important is that follow-up piece. So what's your plan? Let's say, a caller doesn't get picked up, so they go to voicemail. What's your plan for getting back in touch with those voicemail calls? I was in a situation actually just last week where I had called a practice, left a voicemail, and this was actually like a personal for me to book an appointment, and never got called back. Had to call them again today to actually book my appointment. And the thing is, I love this practice. I'm not going to go anywhere else. But if I was a new patient, I would have just been calling the next one on my Google search. So having a clear follow-up process so that your office is getting back in touch with those callers that left a voicemail or who hung up on hold, that's going to be, where where you can recover, I guess, a lot of those phone calls is in your follow-up processes. So those would probably be my top three from what we learned in 2020 and what we're anticipating to continue in 2021.
Thank you so much. I think those are things that anybody can implement. Anyone can get their team together, create a plan, coach on these best practices, and be prepared for how they're going to respond to some of these patient concerns that may continue to filter in, honestly, for the next year as patients get back to everyday life and getting back into the swing of coming into the dental office. It's good to hear the call volume is staying high. I think that's a
Yeah.
great thing for the industry. And that people are, no longer afraid to come in and want to get back in the doors
Right.
of the dental practice.
Right, for sure. And that's only going to continue as, changes with COVID it continue to evolve. And we get better at handling the influx of volume. So we expect for that to maintain over the coming year.
Excellent. I love those tips. To make some of those decisions, however, you're better suited if you have some data, right? I
Absolutely.
mean, I think it's hard to know what lever to pull if you don't know what calls you are missing, what those peak times are that you need to arrange coverage, and then what the outcomes of your calls are. So I really strongly encourage everyone to make sure you have a system in place to measure your outcomes. And
Absolutely.
you know, Jarvis and Callbox. Some people may not know that we've integrated with you guys. We're partners and
Yep.
continue to grow that relationship. And, together are really just a powerful force to measure the true outcomes from calls. So definitely would encourage everybody to check that out. Thank you so much for your takeaways that you've shared with us. I think, again, whether you use Callbox, Jarvis, or a combination of the two, or anything else to help you measure your call outcomes, it's really evident how important it is now more than ever to have a tool like this in place.
Definitely. Yeah. Well, I'm so happy to be able to share, some of the things that we've learned over the past year, especially. But you're exactly right. At Callbox, one of our favorite things to say is what gets measured gets managed. And so having those actual numbers, the insight to drive your action plans really makes all the difference. So having hard numbers to really understand what's, occurring at your office and using those to make the changes makes all the difference.
Absolutely. I mean, considering especially, the average acquisition cost of a new patient is around $350 at least, just depending on how much you're spending. If you're spending 3 to 4% of your revenue back into your marketing budget, those calls that you miss are just, money out your window, not to mention the lifetime value of the patient, not just that first visit, but over time.
Right.
So hopefully our listeners today are inspired to take some of these tips and put some actions into place. If you're interested in learning more about Callbox and some of the topics we've talked about today, I would encourage anyone to go to callbox.com/dental and learn a little bit more about how Callbox can help you improve your results. For more about Jarvis, please visit jarvisanalytics.com and learn more about how to drive your business through data and analytics, all of which we've touched on today. Katie, thank you so much again for being here. I really appreciate it.
You're absolutely welcome. The pleasure was mine.